I know that sound. It's one of the scariest things a pet owner can hear. That sudden, loud honking cough. It's absolutely terrifying. But I promise, in the next few minutes, we're going to take that fear and turn it into understanding, and more importantly, into a plan. We're going to break down exactly what's going on and what we can do to help.
It's a sound you just don't forget, is it? It's not a normal cough at all. It honestly sounds like they're choking or like something is caught deep down in their throat. And just standing there, watching it happen, you feel so helpless.
Oh, I totally get that feeling of panic. Your mind just sprints to the absolute worst conclusion. Are they getting enough air? It is a moment of pure, gut-wrenching fear. But I want you to just take a deep breath with me. We're going to figure this out together and find a clear path forward. So what's actually causing that really alarming sound? Well, it's a condition called tracheal collapse. Just think of your dog's windpipe, their trachea, as a flexible tube that's held open by these little C-shaped rings of cartilage. In this condition, those rings start to weaken, they lose their normal stiffness, and that makes it a lot harder for air to get through.
This analogy really nails it. A healthy windpipe is just like a sturdy vacuum cleaner hose. It's strong, it stays open, and air flows through it easily. But with tracheal collapse, it becomes much more like a floppy, used soda straw. So when your dog gets excited or takes a quick breath, that straw can actually flatten out. And that is what creates that really unique honking sound.
Now, you should know that this is a progressive condition, which just means it can get worse over time. We actually grade it on a pretty simple scale from 1 to 4. Grade 1 is just a minor 25% narrowing, while a grade 4 means the airway is almost totally flat. Knowing the grade is super helpful because it tells your vet exactly what kind of treatment plan is going to work best for your dog.
And if you're seeing this, believe me, you are not alone. We see this all the time, especially in our smaller friends. Breeds like Yorkies, Pomeranians, toy poodles, and Chihuahuas, well, they just seem to have a genetic tendency for it. It usually starts to show up when they hit their middle-aged or senior years, and carrying even a little bit of extra weight can make the symptoms so much worse.
Hey, if you're finding this explainer helpful, please just take a second to subscribe, like, and share. Your support really does help us reach more pet owners and give them the info they need to keep their furry family members healthy and happy.
So what does this actually look like at home? Well, the biggest sign is that classic goose honk cough we've been talking about. You'll probably notice it gets way worse when they're excited, or if they pull on their leash, or sometimes even right after they eat or drink. You might also see your dog getting tired a lot faster on walks, panting really heavily, or making a little wheezing sound when they breathe. Okay, I need you to listen really closely to this part. This is incredibly important. If you ever see your dog's tongue or gums starting to look bluish or even grayish, that is a sign they are in a severe breathing crisis. It is a true emergency, and you need to get in touch with your veterinarian right away, no matter if it's day or night. I know heading to the vet can be stressful, but it helps when you know what to expect. We'll start with a really gentle physical exam. Then, to get a good look at what's happening inside, we might suggest some imaging. X-rays can give us a pretty good idea, but honestly, the gold standard is something called fluoroscopy. Think of it like a moving X-ray that lets us watch the windpipe in real time while your dog breathes. It shows us exactly where and how much it's collapsing.
And now for the really, really good news. For up to 70% of dogs with this condition, we can manage it incredibly well without ever needing surgery. Simple changes at home and maybe some medication can make a world of difference. And that's exactly what we're going to talk about next. These right here, these are the game changers. These are the most powerful things you can do. First, weight management is absolutely critical. Losing even a little bit of weight can take so much pressure off the airway. Next, switching from a collar to a harness, that is non-negotiable. It immediately takes all that direct pressure off their windpipe. And finally, just keeping their air clean by avoiding things like smoke or strong perfumes can help soothe that irritation and lead to fewer coughing fits.
Now, if those lifestyle changes aren't quite enough on their own, we have some fantastic medical options. We often use cough suppressants to break this nasty cycle where, coughing causes irritation, which then just causes more coughing. We might also use anti-inflammatories to calm down the lining of the trachea, or even something called a bronchodilator to help open up all those smaller airways further down in the lungs.
And for that small group of dogs with the most severe cases who just need a little more help, there are still great options available. The most common is a procedure to place a stent. It's basically a tiny, self-expanding mesh tube that we put inside the trachea to physically hold it open. It's a very specialized procedure, but for the right dog, it can provide immediate and truly life-changing relief.
So what's the bottom line here? It's this. While hearing that your dog has a chronic condition like this is definitely scary, tracheal collapse is something we can absolutely manage. With an early diagnosis and a proactive management plan, your little buddy can and should continue to live a long, comfortable, and very happy life. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.